to, in terms of teaching and everything?
I'm not really sure what she. I'm not really sure what she's got planned for me. I know that, like, I know there has to be some, like I can't go home without the machine and.
Oh, yeah, yeah.
Yeah.
I mean, I think the home part is she's gonna probably ask you to come to the dialysis center. They're gonna do a lot of teaching, teach you about the machine, teach you how to do it. A couple of times visits to the dialysis center to do it, and then they'll let you fly the plane then.
Yeah.
Yeah.
But I thought that they were gonna do all that stuff here. I don't know what the.
They might do some teaching here too.
Yeah, I'm not really sure on what exactly the plan is.
Okay.
Yeah, I haven't had a chance to speak to her about what we're gonna do as far as
Okay.
like the dialysis and everything.
Sure. Okay. I'll
Do you
touch
know?
base.
Do you know if I'm gonna need any like
Antibiotics? No.
No, not that much more.
No. Probably
Maybe tomorrow.
tomorrow would be your last day.
Mm.
I don't feel you need it, and I kind of did tell Dr. Faswati too. After 7 days, I don't think you had a pneumonia. Fever can come from just fluid in the lungs too, and you haven't had any fever for us. And I think we completed the course. Your blood cultures hasn't grown anything, and the final results I'll get tomorrow. If they're negative, then tomorrow will be your last day of antibiotics. Okay.
Any idea when I'll be able to head home?
Head home, yeah. I would like to sooner than later, but it's Dr. Faswati that's holding you here. Not in a wrong way, but we need to tie up all this.
To make sure, because if I leave and
Yeah.
then I'll just end up coming right back, so it doesn't.
No, we need to get the peritoneal dialysis going here. Yeah. Okay, because I don't want you getting fluid overloaded. One day at a time. Okay. Hang in there. I think you've moved in the right direction, and I think you'll be good. You'll be much better. Yeah. Anything I can do for you?
I was supposed to get some throat lozenges.
Yeah, I wrote for the Tessalon Pearls. They're called Tessalon Pearls. I did write for them. I'll tell your nurse if we can get it.
Because it feels like there's something swollen in my throat.
Yeah. When they did the tube, they put you under. They put a breathing tube, and sometimes that can cause that. But if it gets worse, you let me know.
Okay.
Okay? I'll tell the nurse to get you the Tessalon Pearls. And if you want lozenges, we can give you lozenges too.
Okay.
Okay? Yeah.
All right.
Yeah. Try to avoid cold water, though.
Cold water?
Yeah.
Okay, because that's all I've been drinking was cold water. Okay.
That may make it worse.
All right, because I was drinking like the hot coffee, and that worked. That felt great.
Yeah.
It felt real good.
Yeah. Like hot tea and everything will be better for you right now.
Okay.
Okay? Yeah. Take care, buddy.
Right.
You making urine?
I did earlier.
Not as much?
Actually, no, it was about the same amount of volume
Okay.
that I had before. Around, it was around here.
Okay.
400 something. So I'm still making urine.
Okay, good.
So I'm trying to
Yeah.
make sure that I just keep pumping it out.
Yeah.
But we'll see if I'll be able to keep doing it.
Yep. No, I think you'll be fine. Don't worry too much about it. Okay? Yeah. Hang in there, buddy.
I'll try to.
Yeah. We're here for you.
Yeah.
Okay?
Thank you.
Yeah. You go for a walk?
Yeah, they just brought me back from one.
Okay.
Yeah.
How did the procedure go?
Um,
Recording?
yeah, it went smoothly, but my throat is.
Oh yeah, I talked to Dr. Fulton this morning. He seems to think it's from anesthesia.
Yeah, so it feels like there's something in my throat. Like I can't cough anything up, even though I want to, but I can't cough anything up.
Huh.
But they were saying that the procedure went really well.
Are you having any pain here?
Yeah, it's sore.
It's sore? Okay. Okay. You know, I told you yesterday, if we could wait, say your labs look more or less the same, you're not short of breath, and I saw that your urine output actually picked up this morning. And if you're feeling somewhat okay, like you're not throwing up or, you know, really that symptomatic, I could tell them to just let you go and have you start as an outpatient with the home dialysis team. Because the biggest part that requires you to be here is the catheter. Oh, sorry. Hello? Hi. Yeah. Uh-huh. Yeah. Yeah. Yeah, that's fine. Yeah. Yeah. Go ahead and give. Yeah. Thank you. Yeah. Bye-bye. Your kidney functions about the same, 9%, which I think underestimated because you have a lot more muscle mass. So your real kidney function could be 12% or 14%. But in a nutshell, compared to yesterday, kidney functions about the same. It will not be the reason for me to want to jump start you, okay? What are the pros and cons between urgent start, like doing it tonight, versus waiting, you know, and just doing it in, you know, taking our time doing it as an outpatient? When we have to do urgent start, first of all, we do very low, very small volume, and the risk of having a leak is higher. You know, you see, they have to create the track to put the catheter in, right? Let me see. Is it leaking from yesterday? This blood?
Yeah, it's from yesterday.
Oh. Did they change the dressing?
No, they were going to.
Oh, it's kind of soaked.
Yeah, this is the first time I've seen it. I don't even want to. I don't even want to look at the thing.
I know. Okay. But it looks really good. Okay. Okay. All right. You know, to me, this looks really good. And, okay, tell me how you feel. Do you feel like you're feeling weak, you're feeling nauseated, that, we should just go ahead and start, or do you
No,
think...
actually, I feel good.
Okay.
I feel really good. The only problem right now is the soreness in the abdomen. Other than that, I feel fine.
Okay. Yeah. So what I'm gonna do then is tomorrow I'm gonna have them contact you. And where do you live?
I live here.
Okay.
Mm.
Do you drive?
Well, I didn't drive here, but I do drive. Yeah.
Okay. So you know Scandia, like the mini golf?
Mm-hmm.
Yeah. So that's where the home training site is. You know where they have Shell and then there's Starbucks, multiple gas station.
Yeah, I've been over there
Yeah.
several times.
Right. So that in there's the Vita Cordelia. That's a home dialysis training site. Okay.
Is that the only one? Because I know there's one down the street.
That's
in North Texas.
Yeah, that's in-center hemodialysis. That's when you go and get hemodialysis through the catheter here. Yeah. So that's not the place for you. So that is the place that I'll ask them to call you, okay? And they can check the catheter. They can start the process of training. If you can go a lot, you can go and just get the training in, and you're feeling fine. Within 2 weeks, a smart person like you should pick up like this. And they'll give you the machine, you have to go nowhere. You're basically just gonna be doing dialysis at home. Okay? And nothing delays anything. The first day on dialysis, even though the transplant program is still collecting the data, asking you to do more tests, or they haven't said anything about whether or not you're active, the first day that you meet them there is your first day on transplant list. Once I call you ESRD from day one, that's the day that when you're active, you've gone through the test from the transplant perspective, they're gonna look when is the first day on dialysis, and they're gonna see, okay, it's Monday. So your clock would already start, okay? Say 3 months from now, you're done. It's not gonna be your day one on the transplant list. It's gonna be tomorrow. You would already have 3 months under the belt. Okay? That's how it works. All right? I know this is not easy, and you hate that thing. I know that. But I told you this is not final. Okay? If you try, you've gone through the training, you didn't like it. You really didn't like this. But once you have the fistula, once you have that, and you want to switch, okay, maybe I can do the hemodialysis on my own. I would support you. We will train you again to do this on your own. Okay? There are people like that. In fact, one of my patients just switched because the catheter for some reason just wasn't working. But that's, anatomical problems, not really a preference. If you ask people between this and this, they'll always pick this because it involves no pain. Okay? I mean, you put yourself on the machine and that's about it. There's no poking, there's no pulling, tucking, anything. Okay? So they'll pick that. I mean, that patient of mine probably would have preferred this too, but it just didn't work for him. And now we had to train him, and now he's doing this by himself at home. Okay? So these are the things that we can do. This is not final. Alright? Let me take a quick listen. Deep breath. You're still moving your air okay, so I don't think you're really obstructed, but
You see,
yeah,
I can't spit it out because it feels like there's an obstruction here, and I can't. When I try to cough something up, it won't come up. It feels like the uvula is swollen.
Yeah. Okay, you know what? I'll just use my phone. Can you open your mouth?
Sure.
Stick out your tongue. Okay, okay. You know what? I can still see your airways. Okay. So if you're in the back,
Mm-hmm.
are all swollen, I shouldn't be able to see the back of your throat. I still could see it. Okay. One thing, if you know, if we wanted to try to see if it's some sort of allergic reaction, we could try Benadryl and steroid. Okay. I mean, but it has to be significant enough.
Mm-hmm.
And for that, I probably would have to ask Dr. Fulton and have the, you know, anesthesia people kind of get involved. One thing that I will tell them to do is probably, you know, have a continuous, you know, oxygen monitoring. Because if you really have the closure of your airways, your oxygen level will drop, and that will be the first thing that they will pick up.
Yeah, because I can breathe just fine. It's just a little congested.
Your lungs are clear.
Yeah, but they gave me a lozenge. It's starting to help. It feels my
start
throat.
to help?
Yeah. I'm feeling
Okay.
better. They gave me 2 things. They gave me something called something pearl and gave me like a chewable lozenge.
Yeah.
So it's really starting to help. And I drink some hot tea. So it helped out a lot.
Yeah. They put you to sleep, right, yesterday?
Yes, it did.
Yeah, so they probably intubate you.
That's what they said. They said that the
Yeah.
tube they put in can cause like a sore throat, dryness.
Right, because sometimes they just, you know, they just back it. Sometimes they just, you know, if the procedure is short enough, they wouldn't do the complete intubation and they would just, you know, back you. But they probably felt like you need to be completely relaxed and sedated. That's why they intubated you. And I as long as I could see the back of your airways, you know you're good. It's not gonna. It shouldn't get worse if it's related to intubation. Anesthesia should get better. Okay.
Because I was just probably just gonna sit and let it heal.
Okay. So you think we should just you think you're okay for now?
Yeah.
For
I
not
can still breathe.
starting.
Yeah.
Okay. All right. So I'm not here tomorrow. Okay. Because I'll be, you know, at the dialysis unit. My colleague Dr. Ong. I'll give him the sign out and come take a look at you.
Just coming, you doing your tray, right, sir?
Oh, yes, I am.
Okay, yeah.
Thank you. And then, but the plan is this. I'll just tell him, you know, we have a conversation, and I will have the PD team reach out to you. Okay.
Thank you.
And then they'll call you, and then you go there. If the team here feels safe to let you go, okay, then the moment you leave, the following day you'll be seen, or that day if they let you go soon enough, like early enough, you'll be seen in the PD clinic. But I want to make sure that you're comfortable with the plan. Do you feel like you're ready, or you want one more day, or how do you feel?
I can do it.
Okay. But as far as overall, like as far as going home, like, do you feel ready?
I'd like to.
But
But only if like the pneumonia is all cleared up. And,
you get IV antibiotics for at least 7 days.
Yeah.
I think that's quite adequate. You got a strong one too. You know? And so I think even if they were to let you go home without IV, you'll be fine.
Okay.
Yeah.
Yeah. Because I don't want to leave and then end up.
Right, no.
just
And if you
coming in
feel
there.
like, especially with this, you know, if you want to see how it's gonna go overnight, and plus this observation with what's gonna happen to your throat, if that's the case, then, you know, just stay here overnight. And then if tomorrow you feel fine, then you can go. Okay?
Yeah, but I feel pretty good right now. I mean, once I go home, all I'm gonna do is just do the same thing I'm doing now, just lay until I heal up.
Okay.
I'm not gonna really do anything or go anywhere until I have to go to the class for them to train me.
Yeah. I mean, I'm gonna call them to let them know, because I know they're you know, they wanted to hear back. and see if we're gonna start. And I kind of told them, let me talk to you and take a look at you first. If we're not gonna start that, from my standpoint, you're good to go because we're gonna deal with this as an outpatient. But if there are things that you feel, no, I'm not ready, then
If I feel ready, the sooner we can start this, the sooner then we can get the ball rolling, and the sooner I can get trained on how to do this.
Yeah.
Because the more time I take, the more time it takes, the more I feel like I'm just gonna start slipping. And
Yeah, no, we can't let that happen. So what do you say? You wanted to see how you feel, with this throat thing and pain, and have them change the dressing today, and then see if you'll be up to leaving, or
yeah.
okay. So you want to aim for today, or you want to stay overnight and look for early tomorrow?
I thought I was getting another thing of antibiotics. No.
Well, we can work around your timing, whatever you decide.
Yeah, I'd like to see if I can. I would like to see if I can head home today if I could.
Okay. Let me talk to them. Okay. Let me just at least tell them. From my standpoint, this is my recommendation. This is my plan.
But
And
what do you think?
Well, from my standpoint, we already have a plan. But
Like if you were me.
it doesn't really make a difference. Because I don't really have any concerns that you're going to need oxygen again, or you're going to bleed from this, or you're going to have something, airways compromised happening to your upper airways.
Because this is normal, the throat thing, from
Okay.
from the way you're describing it.
Yeah.
Like, because it's not just me, it's like everybody. This happens to everybody.
It's intubation.
Mm-hmm.
Yeah. I mean, but I know you're not a complainer, So if it's, sometimes you can tell better because it's your body. You feel like, oh, I don't think I should leave, whatnot. Then, we shouldn't. But medically, like looking at your labs and everything, it doesn't really make a difference staying or leaving today or tomorrow because we already have a plan,
Yeah.
But whatever you prefer, I will speak to them on your behalf so that you get what you want.
Okay, yeah, because I would like to go today if I could. I mean,
Okay.
I don't feel not nearly as bad as when I first got here.
Okay. You know
Like,
what?
the breathing, I can even lay back. There's no gurgling of the throat anymore.
Okay. Why don't I make some phone calls, okay? And see if, things can still be arranged, paperwork and everything, so that you can get to leave, okay? And see if they could give you, whatever dosage of antibiotic that you need before you go too. Okay? All right. We'll stay in touch. Yeah, you hear from them. If you don't hear from anybody tomorrow, you have to call my clinic, okay? Have to call my office, all right?
Okay.
Okay. All right. Take care, okay?
All right.
All right.
Thank you for everything.
No problem. We'll meet again.
Mm-hmm.